Hi everyone, my name is Andrew Swaby and I am an intern with Arbor Grace Hospice. This is a private agency that provides end-of-life care to people who has an incurable illness. They treat each patient with dignity, grace, and with compassion. The client is a 47-year-old female from the Republic of the Congo in Africa. The client is married and has a 17-year-old son. They migrate to the United States through about 8 months now through a visa lottery program. The client is a resident of the United States. On the micro level, families speak French, understand very little English. On the meso level, several agency was contacted, such as nursing home, personal care home, etc. On the macro level, Arbor Grace contacted Medicare, Medicaid in order to pay for services for the client. The client's strengths are her husband and her son. Arbor Grace Hospice is helping in the time of her needs, and also the social work department that is advocating for the best interest of the clients. Problem situation: patient is living in the United States for about 8 months now. Patient and her family was living with a friend before she became sick. Patient have to live in the United States for at least 1 year in order to receive any type of benefits. Multidimensional assessment. At this point, the client is doing well. No pain medication. Client need medical care such as MRI to see how well the brain is functioning. Rehabilitation therapy. Also, the client and her family need their own personal space. The plan of action is decided by the interdisciplinary team, which is made up of doctor, nurse, social workers, chaplain, CNA. They came together and decided on a plan of action for the patient. The plan is to find services and resources for the patient. After speaking with the client and her husband, it was still not clear what their needs are because of the language barrier. We knew that she could not receive benefits because of her resident status. We also found out that the husband was working and was staying with a friend. Short-term goal is to find the right resources and services for the patient. The long-term goal is to move the patient from inpatient unit into her own private space where she can receive the proper help. The social work department got in touch with a Catholic priest that speak French that can relate what are the patient needs, what are Arbor Grace need. A plan of action was put in place to find low-income resident, medical treatment, and food for the patient and her family. The patient and her husband was informed on the plan of action that will address their needs. The social work department let them know that there are no guarantees, but they will try their very best to get them some help. The patient and her husband agrees on the plan of action. The social work department implement the plan of action. I was responsible for researching several organizations to call them to see what service they offer. A list of these organizations that matches the client need was put together. The list was turned over to my supervisor. During intervention, the family was given a list of organizations that will help with their needs. The issue that came up, they do not have any money. The husband is working, but he's not making a lot of money. And in order to get bill assistance and rent assistance, they have to have a fixed address. The progress is monitored by the social work department. The intervention was chosen by my supervisor and what organization she think is the best fit for the client and her family situation. Result during evaluation. The patient husband is having a hard time finding a place where he can move his wife. The client family did not reach their goal to move from the IPU. The community leader from the Congo say that they will assist with half the rent when the client find an apartment. Social workers at Harbor Grace Hospice use practice to informed research, employed evidence-based intervention, evaluate their own practice, and use research findings to improve practice, policy, and social service that are delivered to their patients. Reason for termination in this case: patient is doing much better. Patient does not consider hospice appropriate. The process for disengagement varies from patient to patient. If the patient is doing well, patient start moving around. Patient is not in any type of pain. Patient came into Arbor Grace. She was in a really bad shape. Everyone thought she would not make it. Now the patient is transitioned from dependent to independent. She's aware of her surroundings. She could speak. She can get up with very little assistance. She also could feed herself. Plans for transition and follow-up. Arbor Grace will help the patient find a place to live. Once the place is checked out and everything is okay, then the patient will be notified to move. Once the patient is moved into their own place, then a follow-up phone call will be made to see if everything is okay. Reviewing my work with the client is to be more was to be more proactive with the family. The gap that need to be addressed is between Arbor Grace and the patient who cannot afford insurance coverage. My strength is the urgency to find resources for the client, and my weakness is I could not control what happened.